Welcome, everybody. My name is Mary. I'm with the Lupus Society of Illinois, and we are just so glad to be able to provide this educational event this evening. As you can see on the screen right now, that we have another presentation exactly 1 month from today. It's really presented by a wonderful doctor who's presented before. So if you've lived with lupus for a long time or you're new to lupus, this is a really great presentation for you. We hope you can join us. I did also want to thank our sponsor, GSK, GlaxoSmithKline, has graciously sponsored us for all of our events this year, and we are incredibly grateful to have them. A little reminder, this event is for educational and informational purposes only and serves to benefit our mission. The Lupus Society of Illinois does not provide medical advice or recommendations. This information should not substitute expert medical care. Before making changes to your medical care, consult your qualified healthcare professionals familiar with your medical condition and health status. This event is being recorded and will be archived on the Lupus Society of Illinois' website. So just a reminder, please keep your lines muted throughout the presentation, and please don't be offended if I mute you. I'm just trying to make sure that everybody can hear everything. So now let me introduce the main event. Dr. Karen Mancera-Cuevas is the Deputy Director of Health Promotion at the Illinois Department of Public Health. Her professional background includes working in academic centers, emphasizing clinical public health and community-based participatory research at the University of Illinois at Chicago and Northwestern University. She's also worked in local nonprofit and policy level settings. Programs developed under her leadership addressed chronic disease, health disparities in diverse communities of color, specifically targeting women and children at the community level. Dr. Mancera-Cuevas has over a decade of experience in lupus education and research. She's advocated for lupus awareness and has presented on lupus-related issues many times for the LSI over the years. Without any further ado.
So welcome everyone to the LSI lupus and COVID-19 vaccine presentation. So let me see, I can resume this slideshow. So I'm going to be going through a couple of these introductory slides to just, review where we are at, and so I can also minimize parts of the screen. First I kind of wanted, before we, began our presentation, to have a basic overview of what public health is. So as Mary said, I have an extensive background in lupus and have degrees in public health, but how does that kind of intersect with our talk today? So, public health is a lot of looking at population-based work, looking at the health of people and communities. Looks like there's some sort of defaulting that's occurring. We're looking at how do we make populations feel better? How do we reduce disease? How do we prevent disease in populations? So really now with the whole COVID pandemic, we've been able to have conversations as to what is the purpose of public health. So I wanted to introduce that as part of the presentation so that individuals understand the context of what it is that we do. And I represent the State Public Health Department, and in State Public Health, we are looking at the well-being of all of the residents of the state of Illinois. So I'm going to move on to the next slide. I know that Mary had talked to me a little bit about talking a bit about hydrochloroquine and where we are at currently right now with the whole hydrochloroquine issue. This is acting a little bit different today, the PowerPoint, but so an update is FDA has not approved hydrochloroquine for the treatment of COVID. And what we've found now is that currently the FDA approved treatment is we're looking at remdesivir. So remdesivir is what has been demonstrated to show much more efficacy with regards to treatment than before. And so there's really no longer the concern that a lot of the hydrochloroquine is being diverted to the general population, and really now is specifically primarily for treatment groups such as individuals with lupus. So I wanted to just be able to provide reassurance with regards to that. I'm going to go back. So in addition to that, there's then no issue of shortages with hydrochloroquine, which there was at more the beginning of the pandemic response. And scientific evidence has proven that it does not prevent acquiring COVID-19. So rest assured, individuals who are reliant on hydrochloroquine no longer need to have that concern. So I wanted to talk a little bit about lupus and COVID-19, just do a lot of, general broad strokes. So if you're an individual who, has lupus, it's really important to, let others know that, obviously having lupus, having autoimmune disease puts you at higher risk of infection for COVID. So that is really important to note when considering how COVID-19 impacts an individual with lupus. In addition to that, if as an individual that you have come in and someone is positive for COVID-19 that you've interacted with, it's really important to then follow CDC and local health department regulations. So I just, in my introduction slide, talked about the importance of public health, and the importance of following then local guidelines is to adhere to what local public health practices are. So that might be the city that you live in. So Chicago Department of Public Health has their own guidelines. Your county, for example, Cook County Department of Public Health has their own guidelines. And they may have specificities about how you should self-report, how you should quarantine, etc. And lupus is, as we know, is a chronic autoimmune disease. So it can make the immune system less efficacious when dealing with infections, including COVID. So I have wanted to cover that. So in continuation, so medications suppress the immune system, which people with lupus often take, and can alter then these individuals' abilities to respond to infection. So that's really important as well. The ability to fight off viruses is difficult. So one needs to consider that when understanding lupus and COVID-19 intersection. I've also added here that when individuals with lupus get sick, their illness may take longer. And I'm sorry about all of these. For some reason, I'm not even touching the screen. It seems to be defaulting back. So when people with lupus do get sick, their illness may also trigger a lupus flare. So as we know, lupus flares can sometimes spiral with some individuals, and then some individuals can lead to hospitalization. So important considerations to make: people with lupus may also have other conditions that put them at high risk. As we know, diabetes, cardiovascular issues, kidney renal issues, weakened immune system, pulmonary, etc., and affecting major organ groups. So all of those considerations need to be made if you are an individual with lupus when considering COVID-19. So here I wanted to list the at-risk groups. And this is when we consider what is going to be the next group that will be vaccinated group. So we have currently individuals who are frontline workers, individuals who also are essential workers that fall into certain categories, and we also have individuals over the age of 65. And this is an added at-risk group that is also in the next line of consideration for the state of Illinois. Does that necessarily include the city of Chicago? Not necessarily, and the reason that the city of Chicago is held off is because they have not reached their completion of essential workers, completion of individuals over the age of 65. But this is the next group that is included in the state of Illinois consideration. And there are individuals who have different type of etiologies. It can be cancer, chronic disease, COPD, Down syndrome, obesity, with BMI indices that are very specific, heart conditions, pregnancy, sickle cell, smoking, type 2 diabetes, mellitus. So if individuals on the card are asking, why is lupus not on the list? It is not classified under the CDC as an at-risk group. Therefore, the state of Illinois does not have it included in its current list. If the CDC identifies or adds other conditions, then those conditions then can be added to the statewide conditions, because the United States and what states are doing at this point in time is following CDC guidance in terms of priority groups. As we know, there is not vaccine for everyone, so this is the next priority group in line. So then I want to go on to like COVID variants. You know, that as we know, viruses constantly change. There's new forms of COVID emerging. Sometimes variants emerge and then they disappear. As we've heard, there's been variants in South Africa, there's been variants in the UK, and those variants have their own sequence of emerging and disappearing. And really, virologists, specialists within that emerging field have a lot of, you know, theories as to why they emerge and disappear. Sometimes disease mitigation can help with that. Sometimes the virus itself develops its own capacity to become very resilient to treatment. So there is many different causes for variants. Multiple variants of the virus that causes COVID, as indicated, have been found in the US and globally. So it's really important to understand that variants are here to stay, which is largely why there are recommendations that in the future, it may be that we may end up having annual boosters of the COVID vaccine to attribute for those variants, very similar to the flu. So when flu vaccine comes out, it's really designed for the variant that is anticipated to come out in the following year. So very similar line of thinking for recommendations. Here I have FDA vaccine facts, and at the end of the presentation, we will be reviewing those links. So the role of vaccines. Vaccines work largely by mimicking infectious bacteria, viruses that cause disease. So, you know, a lot of this content on the slide is just kind of going to the back to the basics. Why do vaccines work? What is it doing? So vaccines also stimulate the body's immune system to build up defenses against viruses, bacteria that could potentially cause disease. And we have a variety of vaccines that are currently provided to individuals for, you know, illnesses that we are trying to fend off. Polio is one of them, which a vaccine was found, and so individuals are given that. There's also chicken pox. You know, many of us used to get chicken pox as children, and now there's a vaccine for that. So there's different types of vaccines that are addressing the body's immune system for that specific type of a virus that's existing. The parts of infectious organism that immune system recognizes for the body are called antigens. So just a basic concept. The concept of antigens also is very important when one understands the basics of lupus, and why there is immune response in the system and why individuals flare. Vaccination exposes the body to these antigens. So very important fundamental concepts of why vaccines exist and what is their role at an immunologic level in terms of treatment to fend off future sickness. So over 52 million doses of COVID-19 vaccine were administered in the US from December 14, 2020 through February 14, 2021. So this, for vaccine safety, this slide is essentially telling you how many doses. Now, breaking down how many individuals got one dose, how many individuals have two doses. That's more at the granular level, and we will be visiting some of the links at the end of this presentation, which if you're interested in that for the state of Illinois, we can provide you statistics on a daily basis as to where we are in terms of how many people have one dosage versus two, but this is nationwide. So 52 million is a relatively significant number in a country that has more than 200 million residents, approximately. So doing quite well in a very short amount of time. Let me go back to the current slide. COVID vaccines are safe and effective. COVID-19 vaccines have had, trials with individuals that have participated. So there, as many of you know who've participated in clinical trials that related to lupus research, vaccine research also has their clinical trials where they are recruiting individuals from randomized groups in order to participate, different ages, different races, different geographic locations, to be able to determine efficacy. So millions of people in the US have received COVID-19 vaccines, and these vaccines would undergo the most extensive safety monitoring in US history. Why? Because generally, if many of you have participated in a clinical trial, those trials can go on for years. And we were in a situation with COVID where you couldn't necessarily do that. You couldn't necessarily spend years on a clinical trial. So there had to be extensive medical safety monitoring and clinical oversight. So here it's, I'm not going to go into detail, but it's just going into how the immune system works, and then fighting off illnesses to prevent invasion. And then, I talk a little bit here about how the blood contains red cells, white cells, immune cells, and then how all of those intersect in order to fight infection. Macrophages are white blood cells. And then it talks about the role of how they're working with the antigens, how they fight them off, the intersection with that. B lymphocytes are defensive white blood cells, and they attack the pieces of these macrophages. Sorry about that, this keeps going back into the original. And then T lymphocytes are another type of defensive white blood cell. They attack cells in the body. So just basic immunology as to what's happening. And then how COVID vaccines work. So they help our body develop immunity to COVID, essentially. And then they find ways to offer protection because these are mRNA designed. So they supply memory T lymphocytes as well as B lymphocytes. So we are going to provide you a copy of the slides so you have them for reference, but it can kind of tie two and two together as to how those different mechanisms are working. And it takes usually a couple weeks for the body to produce T lymphocytes and B lymphocytes after vaccination. So your body's working, to be able to have those recognitions. It is possible that a person could be infected with a virus that causes COVID-19 just before or after they get sick because the vaccine did not have enough time to provide protection. So sometimes you hear these individuals that's saying, I got sick, I still got COVID even though I got vaccinated. Well, it's because the vaccine didn't have enough time to kick in, and there needs to be enough time. So as the prior bullet says, it typically takes a few weeks for the body to produce T lymphocytes and B lymphocytes. So if your body is not allowed that time, it's not an automatic reaction. So those are really important tips to understand with regards to the vaccine. So vaccine type, currently there's 2 vaccines authorized and recommended to prevent COVID-19. As you have heard, it's the Pfizer vaccine has been talked about extensively. Both of these are mRNA, both Pfizer and Moderna. Pfizer, I wanted to point out 21 days between shots, and Moderna is approximately 28 days between shots. So they are the 2 mechanisms that can be used for vaccination clinics to vaccinate individuals who are eligible at this time. So I wanted to share a little bit about what to expect after you're vaccinated. So sometimes people ask, how am I going to feel? Am I going to feel well? Am I going to feel okay? So on the arm, generally pain and swelling. What is generally side effects of many vaccines. Throughout the rest of the body, fever, chills, tiredness, and headache. And side effects, it can affect your ability to do daily activities, but it generally should go away. If there's anything obviously unusual, you need to seek guidance from your healthcare provider. So with vaccine guidance, most COVID-19 vaccines, you'll need 2 shots in order for them to work. And that is the general guidance. So because you have 1 doesn't mean you should ignore the second one. So you should get the second one, get the second shot, even if you have side effects after the first shot, unless a physician were to tell you you are having adverse effects from the first shot, you should not take the second shot. So that is the disclaimer for individuals who, when in doubt, if you have a severe allergic reaction, you should obviously go back to your healthcare provider. And it takes time for your body to build protection after any vaccination. COVID vaccines that require 2 shots may not protect you until a week or 2 after you're done with the entire sequence of shots. And then how COVID vaccines get to you, vaccine manufacturers, the federal government, the state government, local territories, several partners are involved in order to make sure that you get vaccines. And a lot of this consideration is understanding supply chain. So CDC makes recommendations for who should get the vaccine first, then each state makes a plan. At the end of this presentation, I will show you vaccine locations located within Illinois, but it's also important to understand that there are supply chain related issues with regards to distribution of the vaccine. So many individuals may ask, well, it's taking a long time for me to get an appointment. And also it's important to consider that there are so many appointment slots available on a given day, and you are talking about a very large population that needs to get vaccinated at this point. So demand, if we know the principles of economics, is larger than the supply. So a lot of local health departments, for local pharmacies, Walmart, supermarket chains that have pharmacies built within the supermarket are now providing more accessibility to the vaccine, although it is important to consider that there is still more demand than supply. And that will be until we can catch up with many in the population that need to be vaccinated. So that is part of the logistics of vaccine programs. So in particular, when you're doing the vaccination as quickly as possible with very large populations. So though those are the nuances when one wants to consider how vaccines get to you. They get to us from a variety of mechanisms. So if you live in a county that's very populated, it will be harder to get access than if you live in a county that has fewer population. And it's the difference though is that, let's say a rural part of Illinois may have different types of supply chain issues because they may have fewer facilities that may be able to offer the vaccine, more limited hours, and less resources or less vaccinators. Versus in Cook County, we may have more vaccinators, but we have a greater population to serve. So that, I think, addresses many people's questions with regard to supply chain and vaccination. So the reason for vaccination, as we know, getting vaccinated is one of the many steps we need to do to protect ourselves, right? Particularly now during COVID. Protection for COVID-19 is critically important because for some people it can cause really severe sickness and illness, or potentially death. Vaccines work with your immune system so your body can then effectively fight off the virus, and that is sufficiently efficacious. So that's why we vaccinate, to really make sure that individuals are protected, particularly from the ravages of COVID, which so far has surpassed more than 500,000 deaths in the country. So, and here at the end of the presentation, we will be providing you with the links and with more information where you can readily access IDPH COVID-19 information. As one of my closing remarks, I also want to remind people of the basic premises. So we are vaccinating, but we also need to remember to maintain social distance, washing our hands, wearing face masks, and that practice will need to be continued. Some public health experts estimate past 2021, I was hearing Dr. Fauci was saying that when he was doing an interview, and that just has to do a lot with the fact that we need to have a significant part of the population vaccinated before we can let our guard down. So that's very important to know. And here are references. You know, if you want further information, as I said, the slide deck will be provided at the end, so you can go to, as I said, reliable sites, and please make sure that they're reliable, not entities that are providing misinformation. I think that was a lot of the confusion, particularly at the beginning of the pandemic, a lot of misinformation. These are all either state, federal, or lupus related sites where you can be provided accurate information on the topic. And that is the conclusion of my presentation. So I will pass it back to Mary.
Yes, and I'm really sorry about the whatever that was happening. That was something new, right? Like we did not have that issue when we were practicing. So
no, that's fine. And you know, all of you will have a copy of the slides. You know, the slides are just really a guidance for me to talk, but you'll have that with you so you can review that. And now we'll just go and review the links. So that provides even more information for the audience.
So hopefully everyone can see the FDA vaccine facts link. Is that right? You want to walk us through this maybe?
Yeah, so it's pretty much, you know, like talking about, you know, like what is a path for research and for them to then get, you know, like emergency use authorization. So, you know, kind of the premise of what I was talking about, having FDA approval, getting the DSMB approval, which is, you know, oversight boards, having significant data in order to back up the science behind why they approve, what are adverse events. So adverse events, if somebody has like a heart attack, stroke, was it directly related to the vaccine? Did someone die after getting the vaccine? So they look at a lot of this scientific evidence from research to then provide emergency use authorization. And emergency use authorization here is very specific because emergency use authorization had to be used because we did not do the normal process of like a phase 3 trial. So a phase 3 trial in lupus can go on 5 years very easily, but they didn't have, let's say 5 years just to do phase 3. So you have phase 1, 2, 3A, 3B, maybe you might have a 4, and then, you know, generally after 3B, you would have approval after, you know, a pharmaceutical would go back and forth with the FDA, prove efficacy, then they would get FDA approval. So what was the difference here was emergency use authorization. They had to accelerate it at lightning speed in order to then get approval through the FDA to then provide vaccine to the general population.
Right. And then, but even though it was emergency use authorization and they don't have data from years, it's important to note that they had like over 50,000 people, right, were tested. So the efficacy is tested. It's a safe vaccine. It's just, they just sped up the process.
It's just the velocity that they did the work is 100 times faster than in a normal clinical trial, where that would take, you'd have to have the sample size, so the power of your sample has to be significant. So that means that you've got to ramp up tons of volunteers in a short amount of time to get people in. You've got to have a team that can then, you know, follow patients over time. So you have to have a huge amount of infrastructure to do that. So the timeline emergency use authorization is significant because they did the same amount of work that it takes to do a regular clinical trial that takes longer. And then they're both equivalent. So that's why I wanted for the audience to understand that they were like, well, is it, the question oftentimes is it less efficacious because it was quickly approved? No, it's not. It's just that they did everything at a rapid pace in order to come up with the same outcome that you would in a clinical trial in any other area.
Right.
And it's really largely because of need and demand. So like if the population is being affected by a pandemic as large as COVID, you have to respond at that level. You know, so advocates might say, well, why in my disease state that doesn't happen? Well, it's because it's not affecting everybody. And people aren't afraid of really dying of this. If you encounter a situation like COVID, you're really pressed with time where you have to do something to come up with a solution and a vaccine for the general population.
Right. And it's in your public health. So it's important to note that the whole point of public health in general is to keep the public safe. So this whole process, every step of the way, has been overseen by people whose primary concern is the safety and health of the country. So
yeah. So that is really the role, you know, that FDA plays. It's very critical.
Yes. All right. Should we move to the next one?
Yes.
Okay. Vaccine location.
So vaccine locations, here I've provided you this link, and I really find that it's very important. It's on the slides, and you have there all of the information on vaccine locations. So if you want to scroll down there, translate it into several languages, you enter your zip code, you put in your city, radius. You see there the state of Illinois right now, and you see where are potential places that you can go to or you can send a loved one to for a vaccine. So I really want you to use this tool because many individuals have to put themselves maybe behind multiple lines in multiple venues before they can finally get the COVID vaccine. It is anticipated that as we move through the pandemic, we're no longer going to be in that situation because supply will equal demand. So at this point, as I previously said, supply is more limited and demand exceeds supply. So that's why we're encountering the situation in Illinois and also in other states. It's important to consider that sometimes there's this discussion of, well, you know, a state like West Virginia is much more further along. The difference is that West Virginia doesn't have the same population of Illinois. Illinois also is not comparable to a state like California that has a significant size population compared to Illinois. So it's not easy to compare state to state. There's geographic differences, there's population differences, and there's also accessibility differences. So, you know, measuring, even comparing like a small state like Rhode Island, where there, you know, the quantity of land that covers the state is very minuscule compared to Illinois. They're not fair comparisons. So please keep that in mind when you hear a lot of these comparisons state to state. Each state needs to be considered with its own nuances and localities. And even within each state, let's say the realities of DuPage County are very different than Sangamon County, where Springfield is located, because the communities, accessibility, clinics, population density is very different for that stratified group that's currently in the current phase that we are for vaccination.
Okay, should we scroll down, or is this the main? Yeah.
So you can just scroll down and you can just see an example of, you know, clinics. So there you have Adams County, the address, the city, zip code, county, and then the website. So there is all the information that you should be looking into if you want, and you can look it up according to your city. So most in Cook County, there is several county health departments. You can be looking in your locality to see if there's something there. There's also, I believe, as you scroll down, also other entities that are listed, CVS's, Costco's, all that information, the Evanston County Health Department, where to go to. And on their website, they could also provide even more information for individuals who live within those proximal areas.
So if you're, like, I'm in Cook County, can I go to DuPage County to get it? Can I sign up that way? Like, would it make sense to think outside the box that way, or?
Well, there are some people who have gone to other counties. The only challenge with that is that certain counties have prioritized residents from that county. So if they're asking like for a driver's license, it's clearly going to say that if you belong to that community or not, if you belong to that city or not. So that's why if you're going to go to another county, it is best that you inquire beforehand before going all the way down there to make sure that that is allowable within that city or county or jurisdiction. Obviously in the Jewel Osco, it's a very different situation because they service the general consumer Hy-Vee, which is very common downstate. There's not that many Hy-Vees, and Cook and the Collar counties, they are going to also be, they're like, you know, like a Walgreens or a CVS.
Right. So probably sticking within your district or your county is
advisable, unless, you know, that county where you would like to go to has agreed that you can come and they are open to receive residents outside of their county. Their priority, if they are a county health department, their priority are the residents of their jurisdiction. And they are going to prioritize them. And that has really been their priority. And it is also for regular care. So it's not like you can go all the way down there and get any other type of regular care. So just put that as a consideration as well. But there's also several private pharmacies where you could, maybe you want to list yourself in every single Jewel or every single Walgreens and every single CVS. Those are considerations where you could really essentially go anywhere to do that.
Okay.
You're not restricted by geography.
Should this whole page just this, or should I continue to scroll down?
That's just an example for people to see, so they can see Jewel Osco's got tons and tons of them.
Yeah.
So just an example so that everyone can kind of, get the gist as to why that might be a useful tool and resource
Okay.
for use now.
Okay. All right. So next tab.
Yes. So here is IDPH website, publicly available information on COVID-19. So there you see it lists what phase we are currently in, how many vaccines have been administered, how many cases, probable deaths, variant cases, confirmed deaths, total tests performed, and recovery rate. So that's in real time what is going on in the state of Illinois. And then as you scroll down, there is more information here with regards to symptoms and treatment, how to get tested, vaccination. There is even more vaccine sites there. We've already seen vaccine locations, but there is more information. And if you'd like to scroll a little bit further down, there's a couple more resources down there where we've got regional metrics. So if you're concerned, well, my region, what does it look like? There's regional metrics. If you're interested in getting information on contact tracing, there's information on that. COVID-19 guidance with regards to places of worship, funeral homes, schools, sports, long-term care. That's along the lines of when I present to the beginning, the importance of a public health department is to encompass a lot of these things. And then there's also travel advisory, data visualizations on vaccine statistics. So if you want to get really granular, you can go into those tabs and look further, like, okay, what's going. So if you want to go into Illinois data visualizations right now, we could kind of see if you want to go there. Yeah. And you want to go lower, a little bit lower, you just kind of enter your zip code, select zip, select county, and you can just do a tabulation there.
Okay. First, I'm having. Oh, here. You know what I think.
The state of Illinois. Yeah. So if you scroll a little bit further down, you can see the entire state. As you see, it's very big when you look at it at this list. So it just shows you like you're right there where you've got the tab. You've got so many cases.
Right here.
Like 60,000. Of 60510, you have cases of 1,944 right there at that time.
So it's yeah, that makes sense. And then this is active total cases right now or total cases since the beginning?
This is cumulative cases.
Okay, so all in, yeah.
Oh, yeah, so that would be total from the beginning. And you can see, like a little bit further down.
Okay.
There's sometimes, like the legends that will describe, and so like, let's say, for example, zip code, what is it? Like 6002 at 15,000 tested, 1,672 total cases, and then non-applicable deaths. So that means that there were no deaths reported. And then you can look further down. Look, if you look at age demographics.
Oh, okay.
You can see, wow. You can see then the breakdown of then how many in the total, are, and within age groups, you're seeing within race, ethnicity, then there's gender. So there's a lot of good stuff here that I think that participants on today's Lupus call would be interested. So this is how you can get your hands on real-time data rather than necessarily reliant on mainstream media, which sometimes can skew what this means. Here you can go directly to the source and interpret it on your own.
Yeah, that's awesome. All right, so next one.
The COVID-19 vaccine. So here has everything here, one-stop shop. So you've got your vaccination plan, your documents in 4 languages, vaccine eligibility, vaccine locations, all in one area. So if you want to just learn everything about COVID-19 vaccine in the state of Illinois, this is the place to go to.
Awesome. Yeah, it's really a wealth of information. All right, great. Then we do some Q&As. We're not going to do live Q&As, but we have some that were already, sent in. So we're just going to go to that. Can you guys see my screen?
No, I think right now we can just see the IDPH website screen.
Okay. Oh, you know why? Because I have to, oh no, I'm not sure why. Let's see. We're going to give it one more try to see if we can get that. No, it's not taking it. I'm not really sure why, but anyway, we can just leave this this screen up. I don't know why that's happening, but it is. So, but let's do the questions because we are actually running out of time. So we're going to do these questions that were pre-submitted, and then if anyone has any questions, additional questions, then email them to me at mary@lupusil.org, and I will work to get them the answers for you. Okay. All right, Karen, you ready?
Yep.
The first couple questions are from Jamila. How effective is the COVID-19 vaccine in lupus patients?
So there's no evidence that people with lupus should not receive the vaccine. According to the CDC, there's actually no reason to think that taking the vaccine will result in an inflammatory response, a flare for a person with lupus or other autoimmune disease.
Okay. Is one particular vaccine shown to be more effective than another?
So currently we do not have information yet to make a recommendation for one vaccine over another. As vaccines become more readily available, it will be important to talk to your doctor about which one might be right for you. Both vaccines that are currently approved require 2 doses. So when you receive the vaccine, both doses should be made by the same company. If your first dose of the vaccine is made by Pfizer, your second dose should also be by Pfizer. If your first dose is made by Moderna, your second dose should also be made by Moderna.
Okay. Another one from Jamila. Were lupus patients included in any of the trials?
So it is unlikely that many people with lupus were included in the clinical trials for vaccines.
And that's probably because the number of lupus patients are low, right?
Yeah. Yes,
Yeah.
and they are not easy to recruit into trials. I can tell you that firsthand.
Okay, so next question, will my meds impact the efficacy of the vaccine?
So unless there's another reason not to take the vaccine, such as history of severe allergic reactions to vaccines, it's generally recommended that people with lupus receive the vaccine.
Are there side effects high among patients with lupus? My apologies.
So the side effects, generally there's not an issue with it being serious. Sometimes people have sore, achy arms, but some people develop low-grade fevers or chills and feel tired. This is because the vaccine is working and causing a response from the immune system. In most cases, these side effects are not dangerous and will go away on their own within a short time. Please call your doctor if these side effects last for more than 2 days or if your side effects are more severe.
Okay. This question is from Devin. I have a question about the COVID vaccine. With Illinois expanding eligible groups in phase 1B, does that include those with SLE lupus and lupus nephritis?
So no, the 1B group currently does not include individuals with SLE lupus and lupus nephritis. And I specifically answered this question during the presentation as to why and the CDC guidelines. So
yes, right. No, right. People can refer back to that one. So here, this is the question with the long entry. I have a question. I was already able to receive the first dose of the vaccine a few weeks ago. I had a reaction to the vaccine, which caused me to go into a flare exactly 1 week after receiving the vaccine. My rheumatologist was able to help me get my symptoms under control, and thankfully I'm doing well. At this time, he also recommended that I hold off on getting the second dose of the vaccine. My healthcare science-oriented self-searched the literature for information regarding vaccine responses in people with autoimmune disorders, But of course, with this all being so new, there was nothing that I could find before or after I received the first dose. I understand that specific recommendations for my case cannot be made. Therefore, my question is pertaining to whether there are any protocols in place for proactively supporting people with lupus so that they can safely receive the vaccine without causing a flare-up, or at this time is the approach only reactionary if the vaccine causes an issue?
So I would say based on that the approach at this time is reactionary if the vaccine causes an issue. And as I mentioned in the presentation, if you're having any type of reaction, you need to consult your physician or primary care provider after the first dose. So that should really be a very close conversation with your provider.
Okay, so I feel like I'm getting the theme that anyone with lupus who wants to get everyone should get the vaccine. They should talk to their doctor though about their specific case because lupus is so specific, correct?
Yes, yes.
And also it's important to note that when you go get your vaccine and you know that there's a record that you have lupus, because if something does happen, then they're tracking that now. Isn't that right, Karen?
Yes.
Like, yeah. So even though there might not be data now, maybe next week, if there's an issue, they'll know because enough people with lupus talked about it. So if anyone has questions about that, they can contact me. All right, next question. Many people had this question. Are there any related medications that would need to be avoided before or after getting any of the COVID vaccines?
So in general, lupus medications will not affect how the vaccine works. In some cases, particularly for those who take powerful immunosuppressant drugs, your doctor may have special instructions for you so that you can get the greatest possible benefit from the vaccine. But please check with your doctor if you're concerned about how the vaccine fits into your treatment plan.
Okay. Next question is from Bridget. Any lupus-related reason a pregnant or lactating woman with medically well-controlled disease couldn't get the vaccine?
So, so there are not yet any data on the safety and effectiveness of any of the current COVID-19 vaccines being studied for women who are pregnant or breastfeeding. However, though, due to the overall safety of the vaccine and the known risks of COVID-19, the CDC recommends that pregnant women should receive the vaccine if they're in another high priority group. So if you're pregnant and have lupus, please talk to your doctor about the possible risk and benefit of the COVID-19 vaccine.
Okay. All right. And then this question's from Mary. If you have lupus or any chronic illness and organ involvement, is there added value to getting your vaccine at a medical center as opposed to a pharmacy?
I would say that this should be discussed with your healthcare provider in the event that you are possibly in a situation where you may encounter lupus flare. So, you know, always with the issue of vaccines and, you know, like accessibility, it's very important for you to have conversations with the provider. There are individuals with lupus that are very stable, don't have a lot of secondary complications, maybe may see the rheumatologist once or twice a year, but then there's other individuals who see, you know, a rheumatologist almost every 4 or 6 weeks because of how their lupus is being managed medically with their provider. So if there is more serious involvement, there needs to be a conversation with that individual who is the healthcare provider.
Okay. So by and large, like the major takeaways, it's safe. It's been proven effective through the trial. And if you have lupus or really any chronic illness, because I know we probably have some people on the call who don't have lupus, that they should really be in communication with their doctor. So one thing you did say was if somebody's sick, if they have the side effects for over a couple of days, then that's something that they should bring the attention to their doctor, right? They should contact their doctor or the location where they got the vaccine.
They should be contacting their doctor primarily because that's the individual who understands their medical history and can provide appropriate recommendation. The vaccine site may not necessarily be part of the origin or location of continuity of care, particularly if you're going to a pharmacy, you may not be seeing your doctor obviously in a pharmacy. So that those need to be conversations with your healthcare provider.
Okay, yeah. And then as they collect information on lupus and all other chronic illnesses or information, that'll get updated to one of these websites, right? To the Illinois Department of Public Health site.
Yeah, so you'll have more information on as we, acquire information from the CDC. So a lot of what you see on the state public health site is funneled through the CDC, besides what are nuances for Illinois. So like, let's say there might be particularities with opening up of schools that we are working with the Illinois State Board of Education that is specific to Illinois. That's not in another state. We are working with is beyond that. So, or there might be guidances that we're working with, the Office of Economic Opportunity that impacts businesses that are Illinois specific businesses or Illinois specific employers. So that's why it's very important to not only rely on what is the national guidance, but you also need to rely on the state and then the local guidance, because those sites reflect the nuances and guidelines, guidance, and the rules that we are following based on locality.
Okay. All right, wonderful. And then this, of course, back to this site, I just wanted to show one more time with all of the different sites and how to use this, because I have heard from lupus, well, everybody, it's kind of hard to schedule the appointments, but you just keep trying, right? That's
you have to keep trying. You have to work with your provider to make sure also that you can look at other potential locations. I know several hospital systems also are bringing in their patients that are eligible. So you should also contact the hospital system where you're being currently treated to see what is the wait list time to get a vaccination there, and then consult with your provider to see if it's safe to then get it elsewhere if that location is not available.
Yeah. All right, wonderful. Well, thank you so much. And thanks everybody for calling in. If anyone has any questions, please go ahead and send them to me via email, mary@lupusil.org, and I will forward them on. Karen, thank you so much for taking the time today. I know that you've been incredibly busy for a year now, because that's we're coming up on a year that we've been really struggling with this. So hopefully I'll see everybody at next month's event. Registration is free, so we hope to see you there. And with that, I will say thank you again and good night, everybody. Stay safe and be well.